Last time on Martin General Hospital, Mr. Pete and Miss Cookie, no Luke and Laura, Mr. Pete and Miss Cookie were at a crossroads when Mr. Pete surrendered control of the TV remote. Miss Cookie was trying to watch Gunsmoke.
I want to watch Gunsmoke.
You don't need to watch Gunsmoke.
Yeah, yes I do.
Oh, you don't.
That's very important.
Now, this soap opera is probably not good for ratings. Not enough drama here. In fact, no drama when you got a couple like these two who love each other to death. And only death will keep them apart. And ideally, that would be a natural death, not a premature death because Martin General Hospital went bankrupt and closed. In order for government to be of the people, by the people, and for the people, the politics has to get closer to the people. I'm John McCann, and this is the Closer to the People podcast, a production of North Carolina Black Alliance. And we interrupt this routinely scheduled podcast to inform you that this episode, and this episode only, will not be referred to as the Closer to the People podcast, but instead the Closer to the Hospital podcast, because that's the focus of this episode, getting people closer to healthcare, particularly the people of Martin County, North Carolina, a healthcare desert. Similar to the way deserts lack water, healthcare deserts lack access to the things that are critical to sustaining life, like here in Martin County. Ask me why this is considered a healthcare desert. Yo, why you call Martin County a healthcare desert? Because Martin County ain't got no hospital. Martin General Hospital closed in 2023 because the Williamston Hospital Corporation filed for Chapter 7 bankruptcy. That's not good for Mr. Pete. He has to keep a check on his heart, and he's got asthma.
With my age and so, it's to put me down, and I need some help then, Not wait till another hour or 2 hours or 45 minutes. I need some help then.
Mr. Pete and Miss Cookie live in Martin County's Oak City. Oak City is small. One set of traffic signals, small. Right.
And I gotta go to the closer hospital I can get to, to get some help. And I'm sorry that they closed the place because people need help around Martin County.
The closing of the hospital has meant longer drive times for Martin County residents seeking access to health care, which is not a mere inconvenience when you think about emergency care, when time could be the difference between life and death. If Martin General was still open, Miss Cookie, Dolores and Pete Wilson, if Martin General was open, Miss Cookie could get Mr. Pete there in about 20 minutes. The closest hospital now is a 45-minute ride outside of the county. Mr. Pete is 80 years old. He doesn't have that kind of time.
The hard part is that if we're in critical care, we need help then. We don't need to wait 35, 40 minutes to get some help. We need help then.
Oh, it's a big deal. It felt like everybody in the county was at this public hearing in early June. ECU Health, as in East Carolina University, is proposing reopening Martin General as a rural emergency hospital. It will be the first of its kind in the state and just 20 minutes away for Mr. Pete and Miss Cookie. It would not be a full-service hospital, just emergency and outpatient care with stays designed for 24 hours or less. If inpatient care is needed, ECU Health Beaufort Hospital would be the primary hub. Now, all of this is contingent on state dollars in the amount of $70 million to build a new Martin Rural Emergency Hospital and Rural Care Center, and another $150 million to expand ECU's Beaufort facility. Shelley Willingham represents Martin County in the North Carolina House of Representatives. He was at the public hearing. The pressure is on him to get that money from his colleagues in Raleigh and bring it back east.
Jeremy Collins, president and founder of Providence OmniStructure, and president, CEO, and founder of Blackacre, which is a anti-racism, innovation, and connectivity development firm. What I'm not hearing is a full-service hospital actually opening in Martin County, and then also even if the hospital were to reopen tomorrow, will it be the type of equitable distribution of health that is needed in a place like this. I was born in Martin General Hospital. I used the emergency department not 3-4 months before the hospital closed. And what these communities like mine, have developed a culture of being places with low quality health care. And so for such a time as this, in this season of uncertainty, like, we have to reimagine and develop community strategies for what that hospital ought to be. So reopening is a very baseline question. But in reality, I think reimagining, repurposing, redeeming what it means to have healthcare in a community like Martin County, and being intentional about delivering people the highest quality care, whether you make $1 an hour or $1 million a year. Like, we have to be honest and intentional about giving people the care they really need.
He's not hating on the project, just wants to make sure people who look like him are going to be all right.
My name's Karita Giddings. I am the Access to Healthcare Program Coordinator with the North Carolina Black Alliance. We have been exploring, I think, all of the different county circumstances around access to healthcare across North Carolina through our State of Health series. What we're finding is you cannot give a cookie cutter solution for the entire state, but you really have to be centered on people when you think about how do you address access to healthcare in the community. I think you have to take it back to the community and understand, okay, what are the healthcare needs that need to be fulfilled at the end of the day, right? If you have actual community members that require healthcare that needs inpatient care, which means like longer stays, observations, a little bit more time with the doctor, and not that 24-hour turnaround that comes with a rural emergency health center, then I think you have to make the decision that's in the best interest of the community. I think the challenging part that we're realizing right now is funding resources for healthcare are under attack. It doesn't matter if it's Martin County, Caswell County, Anson County, it's across the state. So what we're seeing trickle down, not only from the federal level and kind of folks in North Carolina's legislature following suit, is really a redetermination of how much money Medicaid is going to get. And for rural communities like Martin County, Medicaid is a core financial resource that holds up their healthcare infrastructure. So I know a big part of the discussion is the amount of support financially from Medicaid will the rural emergency hospital receive in order for them to kind of make this financial investment, as opposed to standing it up as a general hospital as it was before. So again, I think what we're seeing is people are taking a step away from community and not really centering our folks as they should when they're thinking about healthcare access. If you're wondering about which way to go, that tells me you haven't talked to community.
It is better than where we are. Good, yes, but quite often we don't want to make good the enemy of great, or vice versa. This is a situation where, look, this is a tier 1 county, and quite honestly, still very segregated. And so, will it be good? Yes. My concern, though, is that the hospital reopens with inadequate leadership, with not a clear mandate to do things different and better, and we still see the same negative social determinants of health.
The University of Wisconsin Population Health Institute tracks preventable hospital stays. As the name suggests, that's trips to hospitals and emergency rooms and urgent care centers that could have been avoided. Nationwide, 2,666 hospital stays per 100,000 people enrolled in Medicare might have been prevented by outpatient treatment. And maybe you're not enrolled in Medicare, but appreciate the larger point about the over-reliance on emergency rooms and urgent care as primary sources of care. Preventable hospital stays are costly, disproportionately impact historically marginalized communities, and, long-term, could negatively impact health and mess up your money. So we go from 2,666 preventable hospital stays nationwide to 2,670 stays that were preventable in North Carolina to 3,000 918 in Martin County. That's based on data from 2022. Now, let's drill down further. When we break it down by race in Martin County, those preventable hospital stays actually get lower for white people. 3,495 preventable hospital stays. But for black people here, that number balloons to 5,110. That's preventable, costly, hit you in the wallet stays in the hospital for things that could have been treated in an outpatient setting. Things like congestive heart failure and urinary tract infections. But if there's no outpatient care in Martin County, then, what you want Mr. Pete to do? Where do you want him to go? Well, here's Collins planning to do something that could offset those preventable hospital stays. He's got a mind to convert part of the campus here at the old high school turned middle school in Williamston, North Carolina, into an aquatic center. That's good for health in this county that ranks well below national and state averages when it comes to access to exercise opportunities. And when you think about it, no coincidence Martin County also fares worse than the average county in both the state and the country when it comes to health and well-being.
So the hospital opening is a reflection of a decision, but we really should be thinking about what are the social determinants of health, and are we addressing those at the health service level? And if we are meeting that, if we're doing that well, then the hospital is great. I have concerns that the proposal, as I said, again, not a full service hospital, not being available to the residents 24 hours a day, not having the highest level of care as far as an emergency department, or even the services for those who are facing comorbidities in this area. Those are real concerns. And I think a part of that comes from the fact that there's a small group of people who are having the conversation about what this hospital will be and what is your purpose.
Whether it's a general hospital or a rural emergency health center, if the money's not there for hospitals to be reimbursed for Medicaid patient care, which there is a greater percentage of Medicaid beneficiaries in our rural communities, the hospital is going to suffer regardless of the status that it has if the money's not there. Because prior to Medicaid expansion, a lot of these hospitals were struggling financially because they were providing uncompensated care. And you can only go on providing uncompensated care for so long before you start to get reimbursed or compensated for some of those services, because again, it's a business at the end of the day.
If you're trying to check a box, so if you want a quick, clean answer and check a box, is the hospital opening a good thing? Yes, right? But if you have an analysis or a critique of what health ought to be, what it has been in this community, and are the same people who were running the health scene 5-10 years ago going to be influencing the performance of this new facility, I would say we have real concerns, and it's not a clear-cut win for the Black community.
Would I leave my doctors and go to the new doctors in the facility? The answer would be no for me, because the doctor I go to now was already here. I followed him to Tarboro. It took me a year to find him, but I found him, and I'm happy with him. And I had also asked him if he was working, would he come back? And he said he would think about it. I'm like this, if I have a doctor, I don't like a variety of doctors. That's me. I want to stick with one doctor. If that doctor is doing what I think he should do, treating me well, I'm going to stay with that doctor. And I've had health issues, and I got support from him, recommendations from him, and all has panned out well. So, right now I'm a happy camper. I'm in good health, not the best of health, but I'm in good health. And most of my specialists are in Greenville anyway. So that wouldn't make me change doctor, because Greenville is going to be over there.
Diverse, equitable, inclusive care. Very personal for Collins.
Yeah, I was working out here on the campus and should have been a little more safe. So if anybody listening to this, always wear safety goggles when you're cutting metal or wood or anything. But in any event, this was New Year's Eve 2022, and I was cutting a pipe and a shard of the metal hit me in the eye. And I spent over 6 hours sitting in Martin General's waiting room. Actually had a complaint to the hospital. They did respond to me, but in this context, they see me, or they might see me as exceptional. Everybody's not going to think to to go and file a complaint about the wait time. There were other folks in there who were more ill than me. There was actually another gentleman who I just happened to know who was an elder in our church, came in by himself. His wife had recently passed away, and they were not delivering quality care to him. And I was able to call his daughter, who was able to send another neighbor over to be with him. So what I'm saying is that was during the time of an open hospital. It's not a victory to me if we reset and we go back to that place. I think this is a perfect opportunity to deliver the type of care that you hear about in the great centers of medicine in North Carolina. You think about Durham being the city of medicine. You think about places like Raleigh with Wake Med. You think about you shouldn't just get care or quality care based on population size. You can actually have good care in small communities. I even think about places like Lincoln Community Health Center that serves a small community just outside of North Carolina Central. And there's other examples across the country, across the state and the country. And we have become complacent in rural areas to think, well, because we're out here in the country, that means, we only got 2 nickels to rub together. We don't deserve good health care. We don't deserve good entertainment. We don't deserve good things like electronic connectivity and digital skills. Those things are tropes, and they are messages of the past. If we're going to be a thriving, healthy community, then we've got to take care of ourselves at the cellular level, and that starts in the body.
Mr. Pete is blessed with a body that's been around a lot of years, like his 68 Ford. Still runs. Its body's not as good as his. Says he's going to replace it. Of course, that's optional. The engine inside his body is not. His heart. Being closer to a hospital if he needs a tune-up sure would make Miss Cookie feel better.
I love him. He might get some supper.
Well, now it's wait and see if the state will come up with the money to make a hospital happen in Martin County. The closer to the people cam is clocking legislators. ECU Health is looking for support in the budget those elected officials are working on right now. We'll keep an eye out for a line item to get a hospital in Martin County. ECU Health CEO Michael Waldron is clear. No state support, no hospital in Martin County, where the life expectancy, generally speaking, is about 71 years old, 5 years less than the statewide average, 6 years less than the national average. Again, that's from research out of the University of Wisconsin Population Health Institute. And what if I told you that when you disaggregate the data, white folks in Martin County are living longer than black people here? Nearly 73 years for white people, about 69 years for black folks. In other words, Mr. Pete is a bad man to have made it to 80. He's got to be, when the data tells you Martin County is among the least healthiest counties in North Carolina. Think about that, and think about how all of this intersects with who we put in elected offices. They decide what gets funded. They come up with the policies and programs impacting whether health care in rural places like Martin County is prioritized. Don't miss that. Meantime, keep in mind that a government of, by, and for the people has to get closer to the people.